Thank you for that question. So, what is skin cancer? Skin cancer, first thing that we need to do is to define what cancer is. And in layman's terms, a cancer is an abnormal overgrowth of cells. And therefore, skin cancer is an abnormal overgrowth of cells in the skin. So the warning signs and symptoms of skin cancer largely depend on the type of skin cancer that you have. So first of all, the skin is made up of several different types of cells. And the skin has two major components. There's the upper layer called the epidermis, and there's the middle layer called the dermis that gives us all the sponginess. And then just below that is fat. So the epidermis and the dermis. The cancers that get the most news and that are most popular include melanoma and non-melanoma. That is how in dermatology we've decided to divide them. So if it's a melanoma, this is a cancer of the pigment cells called melanocytes. Pigment cells often produce pigment, but sometimes they don't. So assuming that your melanoma produces pigment, you will see usually a brown spot that is increasing in size. The shape of a pre-existing mole may change its color. It may become itchy, red, it may start to bleed. Any of those signs are warning signs, which means that you should check it out. So that is for melanoma and cancers of the melanocytes. Melanomas that don't produce pigment, believe it or not, you can have what we call amelanotic melanomas. So these melanomas look pink. And therefore, if you have also a new patch with probably brown flecks in it, sometimes there's a bit of brown on the edge. And again, if they increase in size, shape, color, if they've changed in sensation, they need to be checked out because it could very well be a melanoma. And these tend to be the most worrying because we always, generally we expect a melanoma to be brown or black. And it's important for you to understand that it doesn't always look like that. So those are melanomas. There are non-melanomas, of which there are many. So the most common non-melanoma skin cancer is a basal cell carcinoma, and these are cancers of the base of the dermis. These tend to often, and I had a patient just last week who bumped her head a year ago and the area had not healed. And often patients will come in with a non-healing patch. They tend to be pink, flat, sometimes they can be scaly, they may bleed. And that's a basal cell carcinoma. They often don't give a lot of trouble, but that's what they would look like. And those are the warning signs. So a non-healing wound is usually a basal cell carcinoma, which may either be flat or raised. Squamous cell carcinomas. So the epidermis also has, cells in it or squames, keratinocytes, and they can become squamous cell cancers. Often these are pink lumps with a crust of hard skin within it. They're often painful, they grow quickly. These can spread around the body, unlike basal cell carcinomas. And so these are quite important for you to get checked out. That's a very good question. Again, what does skin cancer look like at the very beginning? Often not very much, in truth. So if it's a melanoma, it may just be a slightly odd looking mole. If it's a basal cell carcinoma, as I said, it may be a wound. Often people nick themselves during shaving and it just doesn't heal. So often it may be very nondescript. Squamous cell carcinomas usually start as a patch that we call Bowen's disease, so a flat scaly patch. And over time they get deeper, lumpier and progress, or it may be a small bump that then rapidly grows. So those are the three commonest types of skin cancers, and those three encompass over 99% of skin cancers. The last 1%, which will include Merkel cell, etc., are harder to spot, but my advice would be if you see anything new that's unusual on your skin, get it checked by a dermatologist. Always, because the truth is, you don't know what it is, and it's best to have it checked by a professional. And then you may be reassured that this is okay, but it may not be okay. And the early treatment is always better than catching something that's late, that has spread, that we have to do large amounts of surgery on and other treatments. Right, so skin cancers, as dermatologists, we are quite lucky because our area of expertise is the skin, so it tends to be accessible. So the main modality of treatment for most skin cancers in the first instance is excision. So we'll cut it out. There are some that will also offer radiotherapy, chemotherapy, but usually those are either in hard to reach places, they've already spread somewhere, and those are the main treatments. So some type of surgical procedure is the mainstay of removal of skin cancers and treatments. Right, so I've spent a lot of my time talking about the big three. So basal cell carcinomas account for 80% of skin cancers. Melanomas and squamous cell cancers account for the other 19% of skin cancers. These cancers are often brought on by sun exposure. In each group, there are some that are not related to skin cancer, but usually sun exposure and trauma are at the top of the list for many of them. And therefore, modifiable factors that you can do as a person, what we all can do is, one, practice safety in the sun. The sun, though wonderful and bright, and gives us lots of vitamin D and increases our feelings of well-being, can also cause DNA damage. And this DNA damage progresses to cancer formation. So that's the one biggest thing that we can do. Of course, those with darker skin, like myself, would have a lot more protection from the sun than people with red hair, fair skin, fair eyes. However, darker skin people also need sun protection, though it may not be as severe or as excess or at the same level as skin cancer protection in lighter skinned individuals. And other things, just looking after your health, making sure you eat well, you have your lots of antioxidants, other things that would reduce your chance of getting skin cancer.